can help with that.
He might be able to. Hi, I'm Angie Rasmussen. As you can see, we're still getting the hang of this. It's an improvement from yesterday when I hit go live and I wasn't sure we were going to go live. And so the first thing that came out of my mouth was, oh shit, I think we're live. So this was an improvement. I'm Angie Rasmussen. This is Jessica Malaty Rivera. This is our show, Taking Shots. Welcome. Hi, Jess.
Hi. How's it going? Happy Friday.
Happy Friday. It's been like a sort of eventful week. Like next week's going to probably be more eventful in, I guess, the vaccine world. Although it's actually still been a pretty eventful week. I feel like when I get to Friday, I feel like it's very difficult to figure out if something happened on Monday or if it happened like 8 months ago. Time kind of works that way when we're talking about public health policy these days. This week, there's a lot of news about the upcoming ACIP meeting. So we'll talk about that in a second. But first, we're going to talk about a different advisory committee meeting. And for a show that is an entendre about doing violence to people and drinking alcohol, it's actually also really a show about immunization policy advisory committee meetings. So brace yourselves.
For as long as we have them.
As long as we have them. That's actually a really good point. We will continue to have them. And actually, they'll probably be more fun to watch because they're all just going to be fascist propaganda, essentially, which is fun to watch. It's kind of a sad thing. My husband grew up in the Soviet Union and, he grew up at the end of like a horrible authoritarian government. But there was still tons and tons of propaganda. And so a lot of our home decorations, particularly in our basement, which is like the fun family area to hang out, are like old Soviet propaganda, basically, because I thought it looked cool. And I have to say that decor just seems a lot less cool to me now, because that is what ACIP, I think, is going to be. But VRBPAC, the Vaccines and Related Biologic Products Advisory Committee at the Food and Drug Administration, is essentially like the Advisory Committee for Immunization Practices, or the ACIP that we were just talking about, which is at the CDC. So the ACIP makes recommendations, or is supposed to make recommendations about what vaccines you should take. The VRBPAC recommends to the FDA what vaccines they should approve. And every year they have to do this because every year at the end of February, the entire world gets together with all of their flu data in wherever they decide to do it. This year it was in Turkey. And they compare all their flu data, they go over it, and they predict which strains they think are going to be circulating the next fall so that they can start making the Northern Hemisphere seasonal flu vaccines. Usually they do this every year. Last year they didn't. This year, to my surprise, my great surprise, actually, the VRBPAC is intact with its original members who are all vaccine experts and regulatory experts and manufacturing experts and people who, are the kind of experts that you want in the room when you're talking about should the drug regulatory agency approve these drugs. And so this year, unbelievably, that process happened for seasonal flu shots. And I was really surprised about this, Jess, and I'd love to hear your thoughts, because what those of us who are like watching this know is that the FDA itself is staffed with some of the most horrifically unqualified people on the planet. And even though one of those people, the actual director of CBER, the Vaccine Regulator Office, Vinay Prasad, is on his way out next month, there's still a lot of really bad political appointees at the FDA, and they've really gotten rid of a lot of the career FDA people. And it sounds like from at least Lizzie Lawrence at Stats reporting that the FDA is like probably the most toxic workplace that, well, maybe not me, but a lot of people have ever heard of. And
would she say it's more toxic than HHS and CDC?
Another topic for another time. But yes, I have been in some extremely and continue to be in some extremely toxic workplaces. I I don't know if it's more toxic than HHS. It's a pretty tall order. I mean, as far as I know, nobody is killing people like through negligence and what I would describe as probably negligent homicidal policy. You know, that is what's going on at HHS, and that's what's also unfortunately going on at FDA. So we are getting to see right now what happens when our drug regulatory mechanisms are taken over by people who don't want drugs to be regulated and hate vaccines. So, you know, I wasn't super optimistic. I mean, last year they did approve the flu vaccines, but after a closed door meeting, I was shocked when it's like, who's on the VRBPAC now? These are terrible people. But wait, oh, that's Stanley Perlman. No, he's good. Like coronavirologist God. Anna Durbin, vaccinologist God. You know, Arnold Monto, who came out of like retirement from the VRBPAC to chair the VRBPAC. You know, they brought their best, basically.
Yeah.
So it was a real VRBPAC meeting, and it was completely boring. And I apologize to everybody who was not entertained listening to me talk to myself for like an hour and a half. I did have technical problems, so hopefully everybody went and did something more interesting during that period of time. But I don't know, Jess, what do you think? Like, I feel like this is maybe the last hurrah for something like this, because it's been so depleted throughout the government, and clearly at FDA, they don't like expertise, and they do not plan to use any of it in their drug regulatory actions going forward.
Yeah, I mean, I feel like our whole thing has been like, can we make ACIP boring again? Can we make VRBPAC boring again? I mean, these meetings were so insider for so long, and it not insider to be exclusive and you know, isolated from the public, but it just was so niche. Discussing things like which strains should be included in the upcoming flu vaccine formulation. Like, the general public didn't care. But in the hyper politicization that we've seen in all of these public health agencies, everything is now on public display, and everybody's got an opinion on things that a lot of people just don't have expertise in. I mean, I hope this is not the last boring meeting, because the boring was when we knew that evidence was at least guiding these decisions and not cherry-picked data, opinions, contrarian views, alternative views, et cetera. I mean, I was recently talking to a journalist about how, you know, the MAHA movement is asking the right questions, but they've come in with answers already completely formulated. And these committees, both VRBPAC and ACIP, are the exact forum in which data, evidence based on trials and based on studies are debated, are discussed in very excruciating detail. I mean, it can be very long. Sometimes they're multiple days long, because they are poring over all of the safety data, all of the efficacy data, all of the signals that may have been identified in the trials with regard to adverse events. So it's a kind of a slap in the face to say that these meetings were somehow like not doing all of that due diligence, because that was the whole point of them. The whole point is that no page was left unturned. Every single page and every word on every single page was excruciatingly, analyzed. And so at this point, I feel like I've never really been a person who places bets, and every bet that I would have placed would have lost me money. I cannot tell if it's going to be the last. I cannot tell if ACIP is going to meet next week. I cannot tell if the VRBPAC committee will be completely replaced. Like, I have no ability to see what the future holds, nor do I've had any track record of guessing right. But I will say, I was, like you, pleasantly surprised to see career scientists who have the correct expertise and training part of that discussion and voting according to the evidence about flu vaccines. I was very pleasantly surprised.
Yeah, I mean, it was a really nice change. And like you said, I mean, we've had this conversation, like, make advisory committee meetings boring again. Have advisory committee meetings. The more boring, the better. Can't wait. Can't wait to do other things while it's on in the background again.
Exactly.
You know, this meeting would have been one of those meetings if I weren't so used at this point to watching ACIP meetings or having ACIP meetings get canceled, or, you know, attending these other things that are consequential for policy, but we really can't do anything at all about them. And I just realized, not that I can do anything about VRBPAC, but I just realized like I was really just starved to see my colleagues like doing their professional duty as they used to, and as I always took for granted, frankly. It was also as a virologist, I mean, and as somebody whose career in virology has gone from being just straight in the lab, you know, I haven't worked on exclusively only stuff that happens in the lab since, you know, before the pandemic even. I mean, I work on emerging viruses, so that means that the world and the way that it works is influential on the science that I study. And so, I mean, looking at immunization policy is one of the biggest things that I have to think about. And now, I mean, scientifically, I have even bigger challenges to think about because I have to think about the emerging viruses that I study emerging into a population that is now full of these other preventable diseases.
Yeah.
And one of the viruses that I study is influenza virus, not usually the seasonal ones, but because the seasonal ones can like play nice, and by nice, I mean bad for us, with H5N1 and other highly pathogenic avian viruses. I mean, all of this stuff is really relevant to even basic scientist job, or even, you know, a clinician who's just seeing patients not doing any research. This stuff affects all of us. And so it was really, really wonderful actually to see the level of data that used to be the foundation really of all of this. This is why we never had to think about this stuff. And this is why it was boring. We had systems that worked, that made sure that we didn't have to think about this stuff and worry about it. And unfortunately we do now, which I think is a good segue to say actually why some of these boring meetings are important. One of the things that Jess and I have talked about a lot, and why we're doing this show, is that both of us have been doing science communication for a while, Jess longer than me, I think. Something I kind of stumbled into during the pandemic. But during that time, I really realized how important it was. I still get messages from people saying how much I helped them make sense of a very nonsensical, very confusing, and very disruptive time in everybody's lives. And I see my role as a scientist, both in public as doing good science, like doing important science that has an impact, but also sharing my knowledge in a way that can also help people. And the fact is, really, really consequential decisions that literally affect whether people live or die are being made at these boring ass advisory committee meetings. And so one thing that is really, really important for me and Jess, for both of us in terms of communicating, in terms of the moment that we are in as a society, in terms of where we are politically as a nation. And yes, I do live in Canada, but I'm from the US and I am American, and, you know, my country 'tis of thee. I'll show you my patriotic outfit sometime. The fact is, we are really in one of the most dire situations of our lifetimes. And this is a defining moment for all of us. And so Jess and I think, you know, you can't solve everything. And there's a lot that we can't control here or make sense of. But one thing that we can do is help you all make sense of this moment and really help you understand that these people who are doing this to us and trying to take everything away from us that we value, including our lives, including our families, are doing it because they are stealing from us. They are taking advantage from us. They are stealing our money. They are stealing our power, and they are stealing our freedom. And we really want to make it clear to you guys how they are doing that within our little realm of expertise. So without further ado, now that we've gotten you so excited to talk about all these boring advisory committee meetings, let's go ahead and talk about the upcoming circus that will be happening next week in Atlanta. The advisory committee meeting, or the Advisory Committee on Immunization Practices, the ACIP. So the ACIP, for a little background, for those of you who aren't hot on the advisory committee tip, makes these recommendations. They are approved by the CDC director that determines which vaccines get into the Vaccines for Children program. It determines which vaccines are covered by Medicare and Medicaid. It determines which vaccines insurers reimburse for. So it's very, very important. This is also what's been screwed with by Kennedy by implementing this shared clinical decision-making. for 6 vaccines on the schedule. That basically means talk to your doctor, except not, because what it means is you have to go see your doctor and make an extra appointment, and it makes it harder for you to get a vaccine. So the ACIP used to make the recommendations. It's pretty clear that they're not going to anymore, because last June, Kennedy fired all of them and replaced them with a bunch of anti-vaxxers and some other people. There's a few people that, you know, for lack of a better term, a colleague calls them silent bobs, because they don't really do anything. They just vote the Maha Party line. There's a bunch of really virulent anti-vaxxers. Robert Malone, the ringmaster of the circus. There's Kirk Milhoan, who thinks that we should rethink polio vaccination. They just put a couple people on there who I'm calling Team Gilead, because they are anti-abortion, anti-women, anti-reproductive health, and anti-reproductive freedom lunatics who are probably going to try to take away the HPV vaccine and make it so that pregnant people can't get vaccinated. I mean, it is a bad group of people to be making immunization policy, that's for sure. And then there's like 3 good ones. Then there's Raymond Pollack and Joseph Hibble and Cody Meissner, and they are okay. Joseph Hibble and Raymond Pollack aren't really qualified to study vaccines, but they seem to be evidence-focused and evidence-based. Cody Meissner is the only person on the entire committee who has any type of relevant experience. And he does have a lot, but 3 people against an army of lunatic anti-vaxxers who are also, I should add, making a ton of money from this is not possible to do anything. So the ACIP used to make recommendations. And I think now what they're going to do instead is just create a lot of propaganda. And so when Kennedy wants to do something like turn everything into shared clinical decision-making, and there's no justification for that. Look back at the last ACIP meeting, and that's how you see this model was established. They had some of the craziest people come in. They had Tracy Beth Hogue, the sports medicine physician and anti-vaxxer over at FDA, who's our nation's top drug regulator, also the ex officio member of FDA who sits on ACIP. So she can't vote on the recommendations, but boy, can she share information. And the last time she did, she said how Denmark was the best place on earth in terms of vaccines because they hardly use any. And that's because aluminum is so bad. And then they got Aaron Siri to come in, and he's Kennedy's anti-vax ambulance chasing lawyer friend, who has written books on how we all need to get rid of the vaccine court so that we can sue vaccine manufacturers into oblivion. And then once again, bam, no more vaccines. Kennedy turns to these presentations that were at the last ACIP meeting and says, it was at ACIP, like experts presented it at the CDC. And that's what they're going to do from here on out. They're just, they don't care about making recommendations anymore. They've got their bros over at FDA who can just say, we're not going to approve this vaccine because we don't want to. They didn't pay us for a priority voucher. Or maybe they did, and we're just going to take their money and say, fuck them anyways. That is how vaccine policy is working these days. And I don't know. I mean, I'm with you where I have no idea if the ACIP's going to go forward or not. I feel like we'll find out on March 18th. But if it does, I feel like this is going to be its purpose.
Yeah. I mean, we knew the writing was on the wall in the beginning of the year when ACIP was being formulated, right? And they were sacking everybody who was previously on it and replacing it with all of RFK Jr.'s friends and allies who share in his anti-vaccine ideology. We knew they were going to come after the pediatric vaccine schedules. I have videos on my Instagram from last year saying this, sounding the alarm that the pediatric vaccine schedule was on the chopping block, that they were going to go for it. They were going to reduce it and or like make it just irrelevant. And by irrelevant, what they ended up doing was this shared clinical decision-making, an extremely obtuse, intentionally confusing category in which I think we shared this last time, but polling data revealed that parents don't know what that means. Clinicians don't know what that means. They applied it to some of the most consequential diseases, including hepatitis B, and have essentially created a justification to perceive the vaccine schedule as an a la carte menu, a choose your own adventure with regard to vaccines. And what we thought would be the precursor to more exemptions exactly happened. And now we're seeing a number of states, California, Connecticut, a couple Southeast states, who are now working at the state level to do what they have done in the past, which is to ban religious or personal exemptions to vaccine requirements. Now, mind you, these are requirements for things like enrollment in preschools, daycares, and public schools, and in some private schools. And what they are asking for is for a reestablishment of personal exemption freedom. I was very much involved in that policy work in 2019 here in California. SB 276 and 277 was a very, very contentious time in state history, public health history, and we won with the legislation that basically banned it, but it's now being relitigated because of these MAHA movements. And it is truly because of what's happening at ACIP. So when I say ACIP or ACIP affects everyone, it literally affects everyone. This isn't just about the insider stuff. This is about the consequences of vaccine policies, because when they use the word recommends, I mean, Angie, you mentioned this, the word recommend has a legal implication. When the ACIP, an advisory committee, makes a recommendation and then has submitted that recommendation to the director of the CDC, and then they endorse that decision, that typically happens when things go according to the rules within like 24 hours of the recommendation being received. Those recommendations are what compel insurance companies to decide which vaccines will be reimbursable, which vaccines will be covered in the Vaccines for Children program, which is a public program available to almost 40% of the pediatric population in this country, allowing them to have free access with no out-of-pocket costs for their families and caregivers for vaccines required for those school requirements, vaccines to keep them on schedule. And so it is all a domino effect. All of these things are connected to each other. So that was the beginning of it. That was the beginning of undermining the schedule itself. And then by undermining the schedule itself and it becoming kind of theoretically a la carte, that justifies policy positions to remove requirements. Once those requirements are removed, then insurance companies won't be compelled to pay for them. And then this is how they basically, like you said, take away our healthcare and increase the likelihood of vaccine preventable disease outbreaks occurring here, which tons and tons of data, which we can share in a follow-up Substack about this, have tons of modeling data have showed are extremely expensive for countries and even states to recover from. They can be extremely financially disastrous for people to respond to. It's not just an issue of like people having disease, disability, and death, which are totally horrible. It's also just a terrible financial decision to be doing this. And I hate that we even have to live in a society where we have to commodify the value of public health. But unfortunately, that's kind of the only way to get it through some people's heads on Capitol Hill. You know, I remember lobbying with organizations or just advocating with organizations, basically saying, like, if you spend $1 on vaccines, you get $50 back ROI in your national economy, in your local economy. Even still, we are seeing people today say, personal freedom is more precious than that. And I just feel like at this point, what is most, horrendous, and I say this as a mom, is that we have become so accustomed with harming or allowing harm to happen to the most vulnerable people in our country, children. And I have 3 little kids. And I'm so grateful that I don't have babies right now, because my kids are mostly fully vaccinated at this point with most of the schedule. I mean, my oldest is almost 10. She is just about to start her HPV series. Like, it is terrifying to be a new parent right now, wondering, am I going to have access, or am I going to have the opportunity to get it free, or at least paid for by my insurance? We know that insurance companies have committed to paying for them through 2026. We don't know what's going to happen in 2027.
No, and you know what? I mean, the Trump administration, and I'm not sure how many people appreciate this. This falls into the category of, again, things that are boring to most people, because they are. We've never had this level of corruption, however, in our government, at least not in my lifetime, not that I'm aware of. I did get a 5 on my AP US history exam. That was a while ago, though. But I'm quite certain, actually, that we've never had this level of corruption within our government in terms of its influence on our healthcare system. So at the FDA, there is this program of priority vouchers in which a company can pay the US government, I guess, for the privilege of having like a fast-tracked application. It's like getting the magic pass at Disney or whatever.
Yeah.
It's still not a fast process and it's still very expensive, but in this way you could pay to skip the line, theoretically. That's one way of looking at it. But, you know, if you don't get to skip the line, actually, and in fact, your product gets shit canned by the FDA commissioner because whatever, I mean, you might call that like, I don't know, theft, like extortion, fraud. There's a lot of names for it, but that's what's going on with throughout the federal government, actually. I mean, we've seen it with our universities as well. The Trump administration takes their grant money away and then shakes them down to give it back. And what I think a lot of these institutions don't understand, which is why many of them are creating toxic workplaces for their already very put upon employees. The reason why institutions are not rising to this moment is that for the survival of the institution, it makes more sense from a risk management perspective to just pay off the government, appease them, and you can negotiate and move forward. And that would be fine if this was a rational thing, if this was rational business as usual, but this is not rational business as usual. The US government has never historically been in the business of shaking down its secondary higher education institutions because of political reasons, essentially. You know, Jay Bhattacharya, the NIH director, and this is something I have a feeling we're going to be discussing a lot more about going forward. But he has said that, you know, the cuts to Columbia University were justified because of anti-Semitism. And he's referring to Palestinian protesters at Columbia that Columbia supposedly didn't do enough about. Columbia went so far out of its way to placate the Trump administration that they hired like essentially jackbooted like thugs to patrol the campus to make sure that nobody was engaging in a peaceful protest. And whatever you feel about that issue, about Palestine and Gaza, the fact is, like, you can't just, the government has never been like anti-Semitic. We're taking away $700 million of your federal grant money and putting a bunch of your students out of their careers that this grant money was intended to support, putting the university, which includes a major teaching hospital for New York City, out of business. I mean, all of these things could have been consequences of this. And Columbia's response was to appease them. But the fact is, these people cannot be appeased. They are not reasonable. They are trying to undermine democracy. They are trying to undermine these institutions. And they're doing it to our universities. They're doing it to our law firms. They're doing it to our media companies. And they are doing it to our pharmaceutical companies. And the way that they're doing it is by regulating drugs and vaccines that they don't like into oblivion. And so back to, you know, ACIP, they used to have this important role, as you were saying, Jess. After 2026, you're right. We have no idea. We have no idea if these insurance companies, who definitely recognize that ACIP is no longer a functional panel, we have no idea how they're going to respond to that. The pressure when ACIP started doing this stuff was on the insurance companies to make sure that they were going to be going, you know, they were not going to be stoking the public outrage further. They are health insurance companies, so they have no choice in this unless they're really bad at PR. I mean, there's nothing they can say in this situation except, yeah, we're going to cover it. Don't worry.
Yeah.
But in a year, what are they going to do when it quietly expires? What are we all going to do when, you know, Marty McCary, the FDA commissioner, whoever he replaces Vinay Prasad with, might be even worse than Vinay, I should add, decides to just do what he was doing, override FDA expert committees and make whatever decision he wants because either the manufacturer hasn't paid them enough or they're undesirable for political reasons.
I mean, it's even more than just the insurance companies being kind of left in a lot of confusion. It's the manufacturers too. I mean, we heard from Moderna and Pfizer in the last month and a half that they are walking away from infectious disease vaccine research because they don't have the resources to do that. And listen, let me be very clear. I am not a shill for pharma. I don't get paid by pharma. I have never gotten paid by pharma, and I never will get paid by pharma. So this is me, in my objective opinion, saying that these companies are being harmed by this too. And these also, the cash cow is really where the drugs are. It's not necessarily, it's not really with vaccines. I think COVID being an exclusive example of like where
how much are those COVID vaccines making now for Moderna?
Well, that too. These companies they're getting defunded. There's no incentive to continue mRNA vaccine trial research because, again, they're not getting funded. And let's take a step back and think about what this is doing and why it affects everybody. We heard from the many, many scientists working on this modality for vaccines that this could change and revolutionize so many other disease spaces, including chronic disease called cancer. It is unbelievable to me that something that we have been begging for, I mean, almost literally begging for, a cancer vaccine. Mind you, we have two. We have HPV and HBV, which are cancer preventing vaccines, but to get more. And we realize that there's a way to do this in a very safe and effective and quick and affordable way. And we just are gutting it. This is what we mean by ACIP affect everybody. The decisions that happen in these rooms are affecting every single person. And go ahead.
Oh, no, I was just going to say, I'd argue that if ACIP's not making recommendations anymore and they are just an instrument of propaganda, they actually are going to affect even more people's lives because essentially globally, for ACIP to step into that role as essentially what MAHA Action or Children's Health Defense, these organizations that just constantly, if you go on Twitter, X, whatever, you'll easily stumble across these because you'd be confused to think that it wasn't HHS because they post the same content.
Yep.
ACIP is going to be like that, except they're going to make it like it's a scientific meeting because it's at the CDC and because all of these anti-vaxxers that they put on there, all are doctors. I mean, they're physicians or they're PhDs. They aren't qualified to do what they're doing, but they do have credentials, even though they're not specifically good credentials for this. So it looks to the average person like this is an august body of scientists getting together to have some scholarly discussion and, make some tough policy decisions and go over all this complicated evidence. Like, oh my God, like, look at all this stuff that the CDC has been covering up.
Mm-hmm.
That's where it goes because they make it look like it's a scientific process, but it's entertaining and it's performative and it's not scientific at all. But most people, by the time they are there, they are past the event horizon. And they are going to see somebody like Aaron Siri post a picture of a baby, clip art baby, being attacked by like a swarm of clip art vaccine syringes.
Mm-hmm.
And it is just it is just so stupid. But if you don't know anything about it, you don't even know what ACIP is. And most people don't, because why would you? Like, why would most people know about this if you're not us doing this professionally? But most people will tune into that and be like, why have I never seen stuff like this before? Maybe they have been keeping it from us.
Mm-hmm.
Like, why didn't anybody ever tell me this? And that's the role it's going to have. It's going to add a veneer of scientific legitimacy to all of this insane anti-vax conspiracy bullshit. And it's going to help, smooth the way for essentially what the Trump administration is doing, which is taking all the money that Congress has appropriated to HHS for things like, our health and moving it back to the executive branch, because of course I would like Donald Trump to be in charge of as much of my money as possible. He's definitely the right man for the job. It's terrible. And I think people really need to know that. And it just sucks that, the challenge is trying to make an advisory committee meeting fun. But I think that Jessica and I do a very good job of that because these people help us along too. They are clowns, so they are very entertaining. And honestly, I was born to dunk on them and to just bust on them as much as possible, including their style choices. their hairstyle choices, their facial hair choices, their shoe choices, if I can get a look at them. And their choices to mention their benign prostate hyperplasia sometimes or all the time, like Robert Malone did at the last ACIP meeting. So we're about running out of time. And, you know, Jess is a busy mom, so she's also got stuff to go attend to. And I'm a workaholic with a very unhealthy lifestyle and medical problems. So I'm going to go deal with that. But thank you for joining us. And please join us next week for the ACIP meeting, the ACIP meeting, bright and early, I think, because the agenda is not out yet.
Yes, we'll see.
It will happen. I think it will happen. Usually it starts around 9 or 10 Eastern time. So we'll see around then. We're going to see about an hour, a half hour earlier because we're going to do a little pregame show. Then we're going to do 2 full days of play-by-play and color commentary. And then we're going to wrap it up at the end of the evening. So we really hope that you'll join us for all or part of that. And don't worry if you don't want to join us for all of that. We know that most people are not as just damaged as we are. But we're doing this for you, and we have to do it anyways professionally. So thanks a lot, guys. Have a great weekend. Jess, as always, keep up the good
You too, my friend.
Work, good everything.
You too. Have a good weekend.
All right.
Okay, bye.
Yeah.